Hi, welcome back to Rohrich Knows Best podcast, helping you become a better and more informed you. I'm Rod Rohrich. I'm a board-certified plastic surgeon in Dallas, Texas, talking about all things on wellness, plastic surgery, and things you want to hear and know about. Today, let's talk about tattoos. 1 in 3 Americans have tattoos. So I personally don't have any tattoos. I don't have anything against tattoos, but I think this is something that is not only interesting, but I think people should know about before they go and get their tattoos. So what are the hidden dangers and the potential cancer risks? So let's take a dive on this. Tattoos are everywhere. I mean, I can tell you it used to be that you would see an occasional tattoo, but so many of my patients have tattoos, and I think that's fine. It's just part of the American culture today. But what are the risks? What are the potential dangers? And then could it even include cancer? Now, that's not conclusive at all, but let's just take a look at some of the science. I mean, there is some emerging science and thoughts about how potentially there is some, and this was in the British Medical Journal, that there are certain dyes that potentially predispose you to skin cancer or even lymphoma, and these are the colored ones, especially red. And I think that, we should just take a look at that. Now, there wasn't a specific link between that, but there was a more causality. So, like I mentioned, 1 in 3 Americans have a tattoo. It's a cultural and personal impression, and science, reveals some hidden concerns. So I think these are some things that you should think about. When you have, this is a beautiful tattoo on this person from the internet, and it's just amazing, and it's very talented. But one of the things is, which tattoo inks are more dangerous? I mean, I think it's red, yellow, green. They have red has a more high allergy risk, contains mercury or azo dyes, and then yellow is also photoreactive. Green has some nickel and chromium. And then, blue contains cobalt and aluminum, and black often contains carbon black and PAHs, which is our carcinogenic contaminants. All of these have, some linkage to, the dyes themselves have some linkage to carcinogen. Now, does that mean it's cause and effect relationship? We don't know. And then there's some other ones that the azo pigments can break down into carcinogenic amines, and then of course, heavy metals can do that as well. And pigments can migrate into lymph nodes and organs. So, I think that also some inks that are used are industrial pigments, and they're not approved for skin use. And so you should actually talk to your pigment artist and see what he or she is using. So these are some of the concerns, and especially, the risk with sun exposure, especially red and yellow, can be significant. And they don't fade very well at time. And the most important thing is that they're so hard to remove, especially green and blue. Nobody ever tells you that, okay, you can get a tattoo done in a tattoo parlor at 2 in the morning, and then it'll take you years and thousands of dollars to get it removed by laser or excision, and a lot of pain and discomfort and financial concerns. So does the color matter? Or do the black and white pigment, are they safer? Let's find out. I mean, in fact, in Europe, just like with food, they ban a lot of inks. 4,000 plus inks are banned in EU, and of course, hardly any of these are banned in the U.S. The FDA just tracks these adverts, but it lacks any type of regulation. And in fact, blue 15 and green 7 pigments are prohibited in the EU. So that's very important to know. And of course, the FDA doesn't pre-approve tattoo pigments, so they're still using a lot of inks that are banned. So I really think you should make sure that they're not industrial pigments that you're being used, because they can potentially be toxic. Whether they're carbon black, azo dyes, or heavy metals, they're not regulated or tested. So you really need to take a step back to see, if you're getting that color, red or blue, whether that's really going to be safe for you long term. So, ink also doesn't stay put. They migrate to lymph nodes. They can cause discoloration. and inflammation, and especially if it's an amateur doing it at different levels. And that's really not a good thing to see. So these are all case reports. There are connections. They're not directly been associated, but there's been some history of melanoma and squamous cells and tattooed skin, and then those with azo dyes and lasers, and then carbon black. These are all related to oxidative DNA changes. So there's not a direct line, but there's some cause and effect potential connections. So these are just things that you should know. And the crazy thing is when you get your tattoo removed, lasers can make it worse because they can break down the pigment, the benzene and the cyanide, and give you more exposure to toxic byproducts. So that's another thing. So you had the tattoo and then you get it removed, and then you can actually enhance your potential for long-term, breakdown of pigments, which can be carcinogenic. So I think the key is, what type of pigment you have, what kind of color is it, what's in these dyes, and how close are they to lymph nodes. These are all things you need to look at. So I think before you go, you should ask for the ingredient disclosure. Choose certified or licensed artists that really know what they're doing. And then avoid large colored areas, especially red ink, and make sure they inform you about the health risk. And I think that would go a long way, and especially colored or black and white ones. Are they better? I mean, I think that colored tattoos tend to look better, but they have more toxic pigments. Black and white ones are generally safer, but now they're also not risk-free. But the colored ones certainly look more. They look beautiful, but they contain a lot more heavy metals like mercury and cadmium, and then they have a higher allergic reaction as well. So, and they're also harder to remove with lasers. So black, even though it's safer, it still has some risk because there's carbon-based inks in it, India ink. There are fewer allergens, easier and safer to remove, but it does contain some pHs, some polycyclic aromatic hydrocarbons, which are potential carcinogens. So when you look at it, the toxicity is higher in the colored inks, allergies more common in red and yellow inks, and laser removal is tougher, especially in those of color. So I think, when you take a snapshot of, think before you ink. It should be the byline. It would be my byline. Think before you ink. Awareness, know the risks, make informed decisions. And just like surgery, what's under your skin matters. So be very, very careful when you think about getting that tattoo late at night on a spontaneous suggestion from one of your friends. Be careful. Do your homework, because you really want to make sure that if you decide to have it done, that it's done in a reputable studio with safety certifications and precautions, and tell you about the specific inks they're using. And I really think that will go a long way to not only having a great outcome, but also make sure that it's safe long term. So know before you go, and I think if you follow these recommendations, that's going to be very powerful. The reputable tattoo person, know the types of ink they're using, know the risks, and then make the decision wisely. So hopefully this helped you understand the art and science behind tattoos. No judgment zone, but give me your thoughts, give me your comments. And until next time, stay safe and enjoy. And please remember to subscribe to Rohrich Knows Best podcast.